It is without a doubt that a minor injury such as a splinter wound or a puncture can lead to an infection or threaten someone's health. However, a number of cases can be saved by just administering aid, according to the Director of Medical Services in the Uganda Police Force, Dr. Moses Byaruhanga.
About 60 to 70%, actually, just slight maneuvers somebody can do, you can save lives.
Dr. John Baptist Wanyinyaye, the Commissioner in charge of Emergency Services at the Ministry of Health, says the available facilities are not sufficient to respond to several emergencies. Assistant Inspector General of Police, Dr. Moses Byaruhanga, says lack of knowledge is still a challenge.
I think there should be a national program. In all trainings, people should be taught how to respond to scenes, first aid.
The Uganda Red Cross Society offers medical cover of all kinds in case of emergencies. Irina Kasita, the spokesperson, Red Cross Uganda, says reinforcing such response mechanism in communities will renew efforts.
So we were advocating for a good Samaritan law that protects the first responders. And basically this is to help cover me up, me who is coming in to save your life. So that in case I come, I'm actually protected under the law, and I feel very empowered and safe to undertake this life-saving venture with myself really covered and protected.
First, these ambulances that we have, they are not adequate to cover the whole country. That is number one. Number two, these ambulances of ours of police, they are widely placed.
He adds that behavior and participation of the community escalates the threat.
Some people are rushing to scenes not to save, they are rushing to scenes not to save lives, but they are actually rushing to scenes to steal. Yes, they are checking people's pockets, they are taking their identification documents, which would be used actually to identify some of these people. They are taking them, they are taking their money, they are taking everything durable they find on these people.
Provided that when the traffic and the other police officers reach the scene, they should be able to clear it and give way to the emergency care providers for them to provide the service. So the purpose is the security should be able to ensure that it is safe for the health professionals to offer care, and they should support them to.
Hassan Kihanda, the Deputy Director, Uganda Police Fire Prevention and Rescue Services, says well-laid out strategies will help to mitigate threats.
Inspection, sensitization, and then enforcement of the recommendations made. That is where we lie.
Such priceless recommendations have recently been beefed up by bodies, experts, symposium, among other humanitarian initiatives. According to Makerere University School of Public Health preliminary findings, over 9,000 people perish in road traffic accidents annually in Uganda. Other people who die can also be saved if offered first aid. Shamim Natewa, CTV, PM Edition.